Okay, excellent. All right. Today is June the 14th, approximately 6:09. I'm calling to order Board of Health meeting for the town of Monroe, being held electronically as per our agenda. I'm going to jump right in. I have no public information that anybody wants to participate besides the people that are already here. So we're going to move right to the minutes, which date all the way back to January the 11th of this year. I've already read them, so I will go ahead and motion to approve the minutes as they were written.
I will second it.
Okay. And Amy, seeing as though you're the only other voting member.
Yes, I'll vote
Okay.
yes.
All right, so we've officially approved our minutes from the last meeting. So at this point, I'll go ahead and turn the meeting over to you. We can talk about some of the numbers and so forth. Take it away, Miss Amy.
Sure. So I am very happy to report that we are caught up with our environmental health inspections. And we're actually on time for their next set of inspections. So when I first came on, I did a bunch of inspections, and those inspections are now due again, and they're being done by our sanitarian, soon to be chief sanitarian. And so we are on track with that. And then for our revenue, we are going to be a little bit low in our revenue this year because of some of the projections that were put into place. We did have somewhat of a slow start to our septic spring. It did pick up a little bit now, but not quite enough to make up the difference. We're not too concerned about the low revenue, though, because we didn't expend everything since we had that unfilled position and so many changes throughout the year. So we'll actually be fine for the year based on the revenue and the expenditures.
Yeah, as I was looking at it, it looked like the food servicing license actually came in over budget, which is crazy.
Yeah, some people close and reopen, and that's kind of what happens.
The only questions that I would have on any of this is, do you have any idea why the either the well, actually both the B100As are so far off, and like why soil testing is so far down comparably? Have we had any kind of like dramatic decrease in building and renovations and stuff in Monroe? I don't know if you talk to like the building people or the P&Z people with any kind of regularity.
You know, I think a lot of our soils are driven by the real estate market, especially in the spring. And so the real estate market doesn't have a lot of inventory, which means we're not going to see a lot of movement from that. We are kind of changing a little bit on how we're doing the B100 application fee. So, and this is kind of something when I had come in, is if you had already paid that application fee once and we're still using the same B100, we're not making you pay it again. We've already looked at it and approved it. I'm not going to make you pay another $70 for me to look at the same piece of paper again and approve it again. So that could be somewhat of the discrepancy where, you know, before they would make them pay each time they would even look at the paper, whereas now we're only making you pay the first time you get it approved.
Okay. Okay, cool. Otherwise, everything else, you know, was pretty much right there for the most part. I mean, we were obviously like, I don't know, $8,000 short on cash, but it's kind of in most of these couple of things that we were just talking about.
Yeah, and I think the bigger one too is that for whatever reason, her food service plan review revenue line was pretty high, and we only hit 62% of that. And I don't really expect us to. We may get one more plan review before the end of the year for food, but I don't even know if they're coming in yet. So I'm not sure why she projected that one so high, but that I think is playing a part in it too.
we charge a plain review fee of $250.
It depends on the classification of the restaurant.
Okay.
So 250, I think that was a class 3 that had come in.
Okay. Yeah, I mean, as far as the projections go, I can just say that we, just like we did this year, we kind of base a lot off of what we did last year. And looking at it going, all right, do we think there's going to be any kind of change for whatever reason in the coming year? So,
Right.
Okay. All right, I'm good with all that.
And that's pretty much, so we did have some staff changes. We have our community health educator who is leaving us in the end of June. We are looking and interviewing right now to replace her. That's under the ELC2 grant. So that is a durational grant position that will end in May when the grant ends.
Okay.
We are looking forward to starting up again our child vaccine program to offer back to school child vaccinations and catch-up vaccinations. So we hopefully will be starting that this summer.
Take advantage of that?
Yes. So we got the numbers from Trumbull, who had been taking it over last year since it was in transition in Monroe. And they had between 25 and 50 children who came and got vaccinations to catch up for school. So not a huge number, but it's a good resource to have for parents in order to catch them up so they can start school on time.
Is
that a mandatory vaccine now to go to school?
They have to be
Yes,
vaccinated.
Yeah, you have to have certain vaccinations to go to school based on your grade.
No, right. I understand that. I just meant strictly the COVID vaccine.
No, this isn't COVID. This is your varicella, your MMRs, your Tdap,
Okay.
your polios. Yeah, COVID is not incorporated into it. This is under a federal program, so we're not paying for the vaccine. So since COVID isn't mandatory, it's not included.
Right. Okay.
And then we did start our tick identification and tick testing program. So residents can bring in ticks to the health department and have them identified by one of our staff members. And then we mail them up to the state for further testing. So it's been a great way to meet the community, talk to the community, and do some health education about ticks and tick-borne diseases as well. So that's been really successful.
Cool. Like it.
And then we spent a lot of time on Facebook last week with the air quality. So we had a lot of posts going on about air quality and what to watch for and when the different levels were changing. And so our page did get some more followers, which is great. And it's a great way to kind of keep the community in the know quickly. And I think that's about what we have going on right now.
Okay.
Okay.
Any questions on anything up to this point, folks?
Not for me. Just looking at the numbers now, actually.
Okay. Then moving on. You want to talk a little bit about the the personal services ordinance stuff that you were talking about?
Yeah, sure. So I don't think we had any unfinished business. So we're go right to new business.
I don't think we did either because
Okay.
we haven't done anything in forever.
So I understand that there was some discussions about a personal service ordinance that had occurred prior to me coming on. And I just kind of wanted to touch base with the board to feel out like how far you had gotten, what was discussed. Was it something that the board wanted to follow through with, or was it just kind of an idea that had been put out there?
Are you referring to personal services like massage?
Tattoos? Yeah.
Yeah,
Mhm.
well, we had because we had a tattoo shop move into town, we were scurrying around to put together ordinance because we did not have any, nor do we still not have any, because it never made it all the way through the whole process. And unfortunately, I believe that gentleman is now closed.
Actually,
Uh,
we have 2 tattoo parlors
There's-
in
Oh.
Monroe.
Okay,
And I've actually met with both owners. They're both super knowledgeable. One of them is going to do piercings now, so I have actually done inspections on him just to give him some guidance. Tattoo artists are licensed through the state of Connecticut, so the person themselves are licensed. And they take, all of their bloodborne pathogens and all of that kind of training as well. So where I had come from in Fairfield, we did also have a tattoo shop, but we didn't have a tattoo ordinance. So as long as the individuals were licensed through the state, there was no involvement from the local health department. So I wasn't sure what Monroe had been looking at for a tattoo ordinance and if that was something that needed to be done or something we thought or where we were with it.
did you say something needed?
No, I didn't say anything.
Oh, okay, your thing lit up, that's why I was asking.
Oh, no.
Okay. I think it certainly, Nancy was the driving force behind it. Having some kind of set of rules, for them to be able to go in, and inspect, said shop if there was, because obviously, make up something very silly. Yes, the person may be licensed, but what happens when you go in there and there's, I don't know, no hot running water,
Mm-hmm.
or the place is real dirty looking, piles of garbage or whatever, in corners and things like that. I didn't think it had to be done, but she felt fairly strong about it, so I thought it was a good idea.
Okay.
If it's something that you feel we could do without, then I don't have a problem with that. The all of the ordinance stuff that we did research on and figured out what would work well, has all been approved by previous board. And it was all handed off to Ken, which was probably like a month or two before COVID actually hit. And he was going to look at it and then pass it off to the town's attorney to check wording and different things like that, and then present it to council for approval. So that's kind of where it's at. If you like the idea of having it, that way you have some type of, for lack of a better term, laws behind or ordinances behind what you're going to say to these people. I have no problem with that. If you think it's completely superfluous, then no big deal. I'm fine without it. Does anybody have do you have any thoughts about that, Mike? Because obviously we worked on many of hours doing all that stuff way back in the
That
day.
was a while ago. I mean, I'm assuming there's some type of inspection, like you would do a restaurant, like a food inspection, or they get an inspection.
They do not get an inspection. It's similar to the massage where the massage therapist is licensed, but not the floors, walls, and ceilings.
Yeah,
Would
they
think
see
more of
the
a nail salon where I don't know, it's more sharp. I don't know. There's no inspection, and that's a little concerning of some sort. I don't know.
yeah,
Yeah,
and that's
tattoo shops are really interesting because when I met with one of them, and really he took me through his process, he doesn't even, everything is disposable. There's very little autoclaving. What he does, he actually does the autoclave better than, some of our licensed places do it. So, and I'm okay if we want to license them and inspect them. It's just coming up with the right wording for the ordinance, and making sure it's not, all of the things that he has to demonstrate for the state. I don't feel that we should have to be also making him do for the local, because he needs to do that for his licensure
Right.
anyway.
I don't have any tattoos, so I don't know a lot about it, to be honest.
I don't either. It was actually fascinating when he took me through his entire process because I've never really been in one. And so he explained like the entire thing. So like the no hot water to him wouldn't be a big issue because he really, everything is disposable.
Mhm.
So it's,
Well,
you know,
it was the previous guy that was here, actually, we had made up some type of mock ordinance, and we all thought it kind of worked. So actually Nancy went and talked to him about it. Like,
Mhm.
what do you think about these types of situations? And, is this something that's still commonly done in the industries and things like that? I mean, I'm certainly not objectionable to going either way, Amy. Whatever you feel is important. You're the one
okay.
that is going to be standing on the front line with this stuff to say, hey, you need to have this, that, or the other thing. Again, the I can't remember how many pages it was. If you want to get it from Ken, I'm sure he has it someplace.
Okay, but it did pass the board, so
It passed the board, absolutely
okay.
passed us.
And it was tattoos. Did it include massage or just tattoos?
It was tattoos and piercings.
Okay. Okay, so let me follow up on that and see where it is then and what it
Now,
looks like.
massage, we backed away from on 100 miles an hour. There was some type of thing. I don't remember what other department. Oh, it might have even been the police. Like, oh, so you guys are going to take care. Oh, no, we're not taking care of anything.
Yeah, I actually had to do massage parlor inspections when I started in Stamford in the early 2000s, and I would gladly never revisit that again.
Yeah. So, again, if you want to dive into that, we can have some discussions about it. I don't have any problem with that at all. But, quote unquote, policing that kind of thing,
They were very
is
clean.
not going to be an easy thing. So, how, that's kind of the direction that we were all thinking on that at that point in time.
Okay. So let me check with Ken and see what happened with the tattoo and piercings and if it ever cleared the town attorney or not to go to council.
Okay.
And then on our next meeting, we can go back and I can let you know where it is in the process, and then I'll review it too and see.
Yeah,
But I
and
think-
if there's something that's in it that you don't want in it, or something not in it that you think, well, we've talked about all this stuff, we should probably add this, that, or the other thing, then, by all means, we can certainly, vote on it again and push it through. It's not that, it's not that big of a deal. Just let us know what you think is, proper to have in there. And then at that point, it'll just be a matter of, okay, I want this because it needs to be there for this reason. Okay, cool.
Okay, perfect.
Okay.
So next one was the re-inspection policy. So, and that was included in your packet. So what this is the FDA code finally went into effect after 6 very long years of sitting at the state in February, and it changed everything. And so now there's no score on our food inspections, and there's nothing that says somebody passed or failed. So in our old code, there was a score, and if you had any 4-point items or if you had a score below an 80, you failed the inspection and needed a re-inspection in 2 weeks. So it was a pretty cut and dry. Every town was the same. Every inspector had the same, same thing. And so on our fee schedule where we charge for a re-inspection, it was pretty clear. A score below an 80 or a 4-pointer, and you were getting charged the fee. The FDA code doesn't do that. So what a lot of the local health departments and us have had to do is come up with a re-inspection policy so that our restaurants have an understanding of when they're going to be charged that re-inspection fee. So they don't feel that it's being done arbitrarily or targeted or anything like that. So it's kind of, so we have something to follow going forward. So I drafted this up. I passed it through a bunch of different health directors and Ken as well. But I wanted to make sure that it worked with the Board of Health before we, formally put it on our website for our restaurants to see. So basically what it says is there are now 3 tiers of violations. So there's priority, priority foundation, and core. Priority being like what a 4-pointer was. So any priority violations found during inspection that cannot be corrected on site. If you had no hot water found during an inspection, if you had to reopen after closure related to an enforcement action, or if it's required by the sanitarian based on the number and or type of temperature violations found during an inspection. And I think something happened with the formatting on mine, so I'm going to have to fix this one tomorrow. So what the hope is that we put this up on our website, all our restaurants know, so that if anyone does not do well during one of their inspections and meets one of those items, then we would be able to charge them their reinspection fee and move forward and do their next inspection.
Okay, I think you and I had talked a little bit about this. Sorry.
Yep.
And I just want to recheck with you to say that you feel that what you have on here is in essence enough teeth to be able to take care of what you have to take care of as an inspection team. Nor obviously do we want it to be so tough it's nearly impossible to not charge them, have to charge them again kind of thing.
Right.
Just want, again, make sure that it's actually something that's fair and equitable across the board to us as well as to the, to the business owner.
I think so. I went through, and so there's actually more priority violations than there used to be for 4-pointers. So I think we increased by maybe 7 violations. So there's actually more of a chance now that people may have a priority violation versus before. But people now have the opportunity to correct things on site, which was very different than from our old code. So, I think it seemed to be pretty fair. And by, having people correct things on site, we're kind of following what the spirit of the FDA code is, which is getting immediate change to whatever was the issue, so that there's no risk
So
of
you're
any
saying that
illness.
while you guys are actually on site is what that really means?
Yes, they have to correct it while we're standing there.
Okay.
So if for some reason they can't correct it, so like if they have a hand washing sink that's broken or something like that, or if they have no refrigeration or something crazy, then that would automatically trigger us having to come back.
Gotcha.
They
Okay.
gotta know. I mean, that's common sense, I would think.
Yeah, I know.
Okay.
So,
Well,
that's where we
it
are.
certainly seems like it's fair and reasonable to me. I just, again, wanted to make sure you felt it was fair and equitable for everybody as well.
Yeah, I think so.
Okay. So I will go ahead and motion to pass, what are we calling this? An addendum to policy and procedure, or?
This is actually a new policy and procedure because they didn't have one because they didn't need it because it was actually in the code.
Okay. So the new policy and procedure for re-inspections for restaurants.
I will
I go
second
ahead
it.
and motion to accept.
Yes, a second.
Okay. And Miss Amy, you will.
I am in favor.
Excellent. So the vote is unanimous.
Yes, amen.
That is passed. So you'll go ahead and forward that to Ken to send it off to council for final approval.
Okay.
All right.
And then the last thing under new business is something that is actually something I want to work on in the fall, but I wanted to start the discussion now, is updating our fee schedule.
Mhm.
So my thought process is that we would start in the fall and then have it all approved going into budget season in January and have it take effect next July, so that it'll match the budget cycle and the revenues will all change at the same time. So what I am thinking of doing is gathering neighboring town data and seeing what their fees are for some of our things and for some things that I think need to be added. And then meeting with the board and coming up with the fee that, you know, I will suggest a fee and then you guys can let me know what you think based on the surrounding towns' fees.
Yeah,
Okay.
you might want to talk with Barbara. I thought she had the paperwork. Well, I mean, that was many years ago. I don't know how updated it is, but
I think I do. I think the last one was maybe 2000 and I want to say 20. I could be wrong.
Okay, perfect. So I'll work with Barbara and get that information from 2020 and see if there's any changes since then. But there are some new categories that I wanted to add. One of them is what's called a water treatment system. It's when you have well water and you have to have a backwash because of your treatment system.
Okay.
We have installers who are coming in asking about installing it, and we don't have any sort of fee or application. So that was something that I would like to start to work on for next year. And then some
Okay.
other tweaks to our itinerant vendor licensing and things like that. So I didn't know if there was anything the board would also like to see changed or anything that they had heard about being an issue or, you know, concern.
Nothing that I had heard of. Anything, Mike or Enid?
Nope, I've heard nothing.
nope, I haven't heard anything either.
Okay,
Okay, perfect.
so you can go ahead and, you know, work on that over the summer and whatnot. And we can start talking about it later in the fall when budget comes around to plan for it, like you're saying. That'd be great.
Okay, great.
Okay. Anybody have anything that need to talk about? No, forever hold your peace kind of thing.
Good.
Okay. Motion to adjourn.
I'll second it.
Second.
All right, cool. Seeing as though we had 2 seconds,
You don't even need a vote.
we don't really even need a vote here. All right, thank you everybody for your time this evening. I certainly appreciate it. I am going to, where is it? I am stopping the recording as of now.